There's one section of matching. I'll probably give that away during the review. There are three level 3 questions where you basically got to know your stuff. One of them's worth 7 points, another one's worth 4 points, and another one's worth 8 points. And then there's a section of matching. So I want to talk to you a little bit about chapter 8 since we did not go over it. Now guys, this is one of those deals like, you know, I understand I did not cover this information, but there's a lot of review material in this chapter that was covered in chemistry. And since all of you that are in this classroom are all in the clinical chemistry section, when you're reading that, that should be somewhat of a review for you, okay? But there are questions from this chapter that are on the exam, and I'm doing it because it's going to be on your registry. There'll be something pertaining to this on your registry. You know how I feel about PKU, okay? All of these are metabolic disorders, okay, of amino acid metabolism, basically. So it covers PKU, it covers alkaptonuria, it covers those things that we've already discussed and you've already been tested on. I've got questions on this test that are identical questions that were on the chemistry test, okay? So you've seen it before. So make sure that you don't just overlook this chapter, okay? If we did not go over it, I want to go through this chapter and at least hit some highlights that you need to seriously consider reviewing. Page 164, right-hand column, just newborn screening test in general. I'm on page 164 in the right-hand column under newborn screening test toward the bottom. If you'll go up to about 4 lines from the very bottom of that column, it says levels of substances are elevated more rapidly in the blood than the urine. Therefore, blood collection by infant heel puncture is initially tested. So the only concept that I want you to get out of that is, even though this class is urinalysis and microscopy, we deal with testing urines and body fluids. For the most part, when they test for these inborn errors of metabolism like PKU and all of those different disease states, they're usually going to try to detect that in the blood first because that will be the first place they can detect it in. If they wait until it's in the urine, the baby may have already went home. Okay, so that's why they do that heel stick and they test it on the blood. Do you guys remember the name of that enzyme that is deficient in PKU? Phenylalanine, okay, you got the first part, now the second word. It ends in A's, right? But it's an enzyme deficiency. Phenylalanine hydroxylase. That's the enzyme deficiency in PKU. All right? Make sure you read over the section that covers melanuria. All right, there is a test question that's going to come from that. Alkaptonuria. What have we talked about alkaptonuria? What's the first thing that should come to your mind if I ever say the word alkaptonuria? Good. That's one of those crazy ones that if somebody did wait too long to test the urine upon exposure to room temperature for a prolonged amount of time, that urine will actually start to turn black, okay? But there is something, what's the problematic thing of somebody having alkaptonuria? There is a buildup of something in the body that causes people to have adverse reactions. Starts with an H. Good, homogentisic acid. You guys remember talking about that with alkaptonuria? What's another thing that can cause the urine to turn black upon standing? Good. Melanoma, a malignant melanoma. You guys remember that? Melanuria, okay? Melanin in the urine, a malignant melanoma. If you have no melanin, what's that called? I've never really went over this with you, but what's the opposite end of the spectrum?
Albino. Yeah.
An albino, albinism. Is that what you were thinking?
Yes.
All right. When you go through these, and again, I'm gauging this so you can get on your registry. you need to be able to distinguish certain things that will give away one disease state from another, okay? So there is a question on page 176. It's all matching. If you will, turn to page 176. Now, you don't know all of these yet because you probably haven't read this chapter, but there are some that we can pick out that you should already know. Like on number 27 on page 176, PKU. Out of those matching choices that you have, what would match with PKU? Black color? Nope.
No, it's D. D?
A mousy odor.
Yeah, you're right. There you go.
The urine will have a mousy odor in people that have PKU. What's one for alkaptonuria? Black color. Now, by the time you finish reading this chapter, you should be able to answer all of those matching questions. Everybody with me on that? Okay. Here's a good question that you should always remember, since we're on this page 176, number 21. The classic urine color associated with someone that has a porphyria.
It's going to be D. Port wine.
Port wine. Whatever answer port wine is, that's D.
D.
Port wine. Yes.
It's
21.
D.
Number 3, this goes along with what we reviewed just a second ago. Number 3 on page 175. The best specimen for early detection of newborn screening is a
blood specimen.
Blood specimen
from the heel.
You guys remember when we're talking about PKU,
Babies.
We're talking about a baby's heel stick, and we're talking about this right here.
Yep.
Remember that? Okay, so you do a heel stick on the baby. We called this where I worked at PKU slips, but I have found out they test for a lot more than just phenylketonuria with this, okay? And again,
they've upped it. There's 18 tests they do now.
yeah, these are state mandated. You probably won't do this in your lab. They send them to the state health department. The state health department cuts out those little circles, and then Jason could tell you all about that, okay? But you don't have to know. But anyway, they cut out those little circles, and
I know it's mandated by law. It's performed within 24 hours of the baby being born.
okay, let's talk about spinal fluid. Four tubes are usually drawn for a spinal fluid analysis, okay? Remember, I told you they normally take 4 tubes, and I showed you all that stuff. Tell me what departments they go to.
Chemistry.
Micro.
Chemistry, micro, hematology, and the 4th one it goes to micro as well.
Good, okay. You also need to know what temperature. If you can't test those stat, remember each department had a certain way of storing that specimen.
Micro is room temperature.
Like micro would be room temperature, okay? That's one of your objectives. It's like the first or second one. Be able to do that. That question's gonna be worth a lot of points on your test, okay? So I'm telling you right now, that's on your test. You gotta know that, okay? And matter of fact, unless Jason has changed it, you may even see that question again on your rotation exam when you do your clinical rotations for hematology.
You will see that question again.
That's how important that question is, okay? You have to know if you're working in a laboratory and you get spinal fluid sent down, unless that physician has specific orders. Now remember, I told you in the real world, a lot of times, certain doctors that do that lumbar puncture, they're gonna say, look, on tube number 1 and number 3, I want a cell count and a differential. Remember that? Well, that kind of goes against what I just told you, right? But certain doctors, they may change this, but if it just comes down a generic order, you have to know CMH, chemistry, micro, heme, in that order. And if there's a 4th tube, you generally take that back to micro, and I think it says maybe serology test as well.
Send out, so usually 2 to 4.
Do we ever throw away spinal fluid?
No.
Freeze it.
Save it.
Okay, they will save it for years. I would just about bet we could go to CHI right now, and if I needed a spinal fluid, they probably got some in their freezer that are a year old.
Okay. I would usually keep them 2 to 3 years, and when it started getting full, I would start throwing them away. But I would not throw away anything done in like the last 8 months, 9 months. I kept them that long at least.
There was a term I told you guys that you were gonna have to know, okay? And for whatever reason, they love to ask this on registry questions. If I show you a spinal fluid, okay, what's the normal color spinal fluid should be?
Clear.
Crystal clear, should look like water, right? But if I show you one and it has like a yellow color to it, like I showed you, what's the term for that? Xanthochronic. And how can you truly determine if the specimen is xanthochronic?
Spin it down.
Right. And that's one thing, a lot of people, even techs, I think, a lot of techs, it confuses them. In order to determine if a specimen is truly xanthochromic, you are supposed to spin it down first. Because see, you could have a red specimen that truly has intact red blood cells. Well, if you spin it down and then it's clear as a bell, the supernatant, that technically is not a xanthochromic specimen. A xanthochromic specimen would be a specimen that's hemolyzed, okay? That means when you spin it down, you've got a pink supernatant. Now, see, yellow, even though most people think they kind of associate yellow or orange being xanthochromic, xanthochromic can also be red or pink, but it has to be the supernatant. So in order to say the word xanthochromic, they're talking about the supernatant of the specimen. Okay.
So when you spin it down at the red blood cells at the bottom, that's not that, then it's because it's a traumatic tap, right? Usually.
A traumatic tap is going to be blood that has just been introduced because of the procedure itself. Okay. So you guys tell me, if you're working in the lab, they bring you four tubes of spinal fluid. How, from just a direct visual examination, can we determine if that's a bloody tap?
Darker the lighter?
Yeah.
Good. And there's no perfect way to say it, other than there's going to be blood in the first specimens, and it's going to get lighter and lighter. Okay. Now, from my experience, and Jason may have some input on this as well. Usually, the first tube will have a little blood in it, and then it just goes clear as a bell. That's how you can kind of tell it's a traumatic tap. But if all of those specimens have about the same degree of redness, okay, now we're talking about possibly an intracranial hemorrhage. All right.
I've had one that was so bad that like tube 4 was red, bloody, and tube 1 and 2 was so bad it clotted. So,
Oh, God.
really traumatic tap.
Okay, CSF count. So I've got that marked. So you're gonna have to know how to do a cell count on spinal fluid. What are we worried about? Which cell are we really worried about counting on spinal fluid? Whites or reds? Whites. White blood cells. Okay, because you're gonna have to study this, but there's a lot you can determine. Remember, I think the normal range for white cells was 0 to 5 per microliter, okay? But there was a term for if you have an increased white blood cell count of normal cells. You guys remember that term? It's on page 187, pleocytosis. Remember, I told you it's kind of easy to remember on spinal fluid. First of all, if you have an increased white count and the majority of them are lymphs, that's leaning toward viral, okay? And in some cases, viral meningitis, all right? If you have an increased number of white cells and the highest number of cells are neutrophils, remember, neutrophils is not the dominant cell in spinal fluid, okay? But if you have a high number of neutrophils, that can kind of tend to lead you toward bacterial meningitis. Remember, meningitis, inflammation of the meninges, that's what lines the spinal fluid, okay? You guys remember us talking about that?
Yes.
That's why we have to be so careful when we're handling spinal fluid. Always use standard precautions. You better have on gloves, because that's one of the conditions their physicians are so worried about is meningitis. That is highly contagious, okay? What's that process called I told you about when I showed you how to put together all the little pieces and we put it in a centrifuge? Remember when we're looking at spinal fluid and we're trying to actually do a dip on spinal fluid? What did I tell you that process was called?
Cytocentrifugation?
Cytocentrifugation, okay? Why do we have to do that to begin with?
Just bring it up, right?
To concentrate it, right? Because most spinal fluid that we test, there's not gonna be enough cells. If we were to make a cut smear on the spinal fluid itself and try to do a differential on it, we're not even gonna see 100 white blood cells, right? So there's this process called cytocentrifugation, okay? And that's where you put the little cup together. There's a nice little picture in your book that shows it, but that concentrates it and it puts it in one little spot on the microscope slide. Now you put it through the right stainer, okay? And then now all of your white cells, the few cells that were in there are all concentrated, and now hopefully there will be 100 cells. And remember I told you guys, you add a drop of albumin to it. Why did I tell you add that drop of albumin?
Because it helps reduce all the smearing of the cells when it's spinning.
Usually when you look at a cytocentrifuge specimen, the cells are gonna look a little bit abnormal, but it's because of what they went through. It's not, I'm just saying, like, you'll see lots of vacuoles and they'll be distorted to a certain point. That's because of the cytocentrifugation.
They got slammed into a glass window at high speed, they smeared it.
Question, yeah, so what was the role of albumin?
To just kind of cut down on the cell distortion, okay? And it also, I think there's a statement in there that says it basically also helps your count. It helps you to actually, it causes the cells not to be destroyed.
Think of this padding. It's a kind of albumin's a little bit thicker liquid. You add that to it, it's almost like padding when that stuff gets slammed into that slide.
Remember, there are non-pathological cells that are seen in spinal fluid. Okay, when we went over that chapter, we talked about spindle-shaped cells, epithelial cells, choroid plexus cells. Remember, I told you a lot of times those cells are introduced because of the procedure itself. Okay, and I showed you guys pictures of those.
Mm-hmm.
Why would we see macrophages in the spinal fluid? We talked about macrophages and what their role is.
They take out the trash.
Okay, good, yeah, they get rid of debris. And debris can be considered red blood cells.
Yeah.
If red blood cells were introduced into that's one way you can identify a macrophage, is if you catch it at the right time in the dip, you can actually see it engulfing red blood cells. That's the way the body rids red blood cells from the spinal fluid. We talked about chemistry, and I told you that there are 2 primary chemistry tests that are done on spinal fluid. Do you remember what they are? If I just said, okay, what are the 2 most common tests done on spinal fluid in the chemistry department? I don't remember what this is in the book, but I know the answer to it.
It's not glucose, is it?
Glucose is one of them, yes.
Oh, it is.
Glucose and glutamine.
Glucose and total protein. Okay.
Do they do pH on that too, or no?
On the spinal fluid,
They don't.
I don't remember, no, I don't think they do a
Okay.
pH. No, they
I was
do a
just thinking about
pH
something
on
else.
certain pleural fluids and stuff.
Okay, maybe what I'm thinking about now.
Okay, so, give me a name associated with multiple sclerosis in spinal fluid. What do we look for in spinal fluid that indicates multiple sclerosis? What? Starts with an O.
Oh, it's the bands, all of
Oligoclonal banding.
From
okay?
electrophoresis.
Just the same way we did the serum protein electrophoresis, they can do the same thing with spinal fluid, okay? Again, they have to concentrate the fluid first, so they spin it down in a centrifuge, and they take, like the same way we did in there, they take like 10 microliters of spinal fluid, and they do electrophoresis on it, okay? They also do a serum protein electrophoresis. If they see those oligoclonal bandings, okay, and toward the end of the electrophoresis, remember that's going to be the IgG area and the antibody area, the immunoglobulin part, then if they see the bands there and not in the serum, that is an indication that the person has multiple sclerosis. Oligoclonal banding. Make sure you read over that.
I can't even say it, man.
It's okay.
Just let that talk.
What are we supposed to dilute spinal fluid with? Remember, we're trying to I mean, the red blood cells it's not really important in a white blood cell count, okay, on spinal fluid. So we have to dilute it with something that's going to lyse the red blood cells.
Some sort of
It's a real
acid?
dilute
Acid?
acetic acid.
Yeah, it's like
Okay, remember that
2%.
bottle I showed you guys of the purple stuff? Okay, it has acetic acid in it. It also has a staining precipitate in it that will stain the actual white blood cells, the nuclei. Remember that stuff I told you never get it on you because it's really hard to get off? And that's what we're going to be doing in labs. That's what we're going to be kind of working with so you guys can actually get a hands-on on that. A normal CSF protein level. What's the first thing I told you about protein and spinal fluid? Protein in blood, serum, or plasma is in grams per deciliter, okay?
It's in
So
milligrams.
if you take your registry or you take this test, protein in spinal fluid is in milligrams per deciliter. And the normal range for that, okay?
15 to 45.
15 to 45?
Yes, okay, but you can bet when you take your registry, there's gonna be two 15 to 45s. One of them's gonna say grams per deciliter, and one of them's gonna say milligrams per deciliter. You need to at least be able to narrow it down to pick between one of those two, okay? But it should make sense to you. There's gonna be less protein in spinal fluid than there is in your blood. Remember us talking about the blood-brain barrier and all of that, okay? What does a CSF glutamine level have to do with? Remember I told you that I didn't even know if you'd ever do this in your life, but there is in your book, there is a CSF glutamine level that has to do with a certain analyte, that it's an indirect way of testing for a certain analyte in spinal fluid.
Ammonia.
Ammonia. Good. To determine if a questionable specimen is semen, what could we test it for? What?
Phosphatase? That's what she said.
Phosphatic acid phosphatase, PAP, alright? That's that enzyme I was telling you. It's found in other places, but the main area that that's found is in seminal fluid. Probably one of the biggest essay questions that I can ask you about spinal fluid again is going to be, where do the tubes go? Which departments? What temperature? There were a lot of other things we talked about spinal fluid, like why do we run most spinal fluid stacked? Why can you not let them sit around? The cells, just like in urine, if you let it sit long enough, the cells are going to actually rust. Okay?
And the bilirubin
So you
and
got
all
to
of
do
that.
them for the most part stacked. And common sense will tell you if there's a baby coming through the ER and they think that baby may have meningitis, anything through the ER is stat. And I don't know about you, Jason, but I'd say probably at least 60 to 70% of all spinal fluids we got was from the ER. They actually do that lumbar puncture procedure down in the ER. Okay. Now there's some that come from X-ray and those areas, but now remember, it'll always be a physician that does that procedure. And what's that procedure called? I've said it twice already. Lumbar puncture.
Is that sometimes referred to as a spinal tap too?
Spinal tap or lumbar puncture.
Okay.
Yep. Maple syrup urine disease. What would be the first thing that we would detect that?
The sweet smell?
That's in that chapter that was a self-study.
The sweet,
Smell.
yeah.
How should it smell?
Well, it'll be sweet, like maple syrup.
Maple syrup.
Yeah.
I won't have maple syrup on there. I won't make it that easy.
How
I'm just
sweet.
saying. I'm not gonna say maple syrup will smell like maple syrup.
I'm sorry, I like it.
Make sure you read over acquired porphyrias. Acquired porphyrias. There's certain conditions that are more known to cause acquired porphyrias than others. Make sure you read over that. The presence of urinary reducing substances is of particular concern in which patient population? Reducing substances in the urine.
Women?
This is where you gotta put everything together that we've done in this course. What is a reducing substance? Remember I told you?
Adds electrons?
No, that ain't, no. Well, I mean, you're on the right track there, but I'm talking about, I had you guys do a confirmatory test in the lab. You guys remember when I showed you guys the confirmatory test on urines? There's a confirmatory test for protein, what's it called?
Adds salicylic acid.
Okay, what's the one called for bilirubin?
Icter.
Okay, what's the one called for ketones?
Acid test?
Acid test, okay, now I'm getting to the answer of my original question. What's that test that I told you sometimes that we have to do for glucose? It's a backup test for glucose. The cleaning test. That cleaning test is to detect reducing substances. Remember that inborn error of metabolism that I told you about? Galactosuria? Remember I told you got a big long story about that, okay? Whenever you test a urine on a newborn, or our rule was 0 to 2 years of age. What was y'all's? Okay. No matter if it's positive for glucose or not, okay? You have to do a cleaning test. What you don't want to see is you don't want to see a baby, all right, that is negative for glucose but has a positive cleaning test, because that cleaning test detects galactose. That is a reducing substance. So back to my original question, what patient population is tested for a reducing substance? Newborns or very, very young children, okay? Why is that so important? Why are we even talking about it?
It can give them mental retardation or something like that.
Yeah.
Because if you guys can catch that working in the lab, it's very rare, guys. I never had one, okay? I never had one positive, but I've done that test very, very often. But if you happen to catch that, it may be Wendy's first day ever working as an MLT, but if she catches that and then she tells that pediatrician, hey, I'm getting a positive cleaning test on this newborn, okay? Then you're telling that pediatrician, hey, we got to adjust this baby's diet. And if they do it quick enough, guess what?
You're okay.
There won't, well, I'm not saying they're going to be perfectly okay, but I'm just saying there won't be as, the side effects won't be as severe if they change that baby's diet.
Okay.
Okay? So, make sure that you study. This is the chapter I did not go over with you guys. Study galactosuria in newborns. Okay, that's the testing of reducing substances. Make sure you read over CSF glucose, the normal range for a CSF glucose. If I remember right, I believe like it's a certain percentage of whatever the serum glucose is.
60?
You guys remember us talking about that? We even had a review question I told you to look at that gives a CSF glucose value.
Yes.
Make sure that you read over that.
This is page 199. Page.
Before analysis, semen specimens should be what?
Diluted?
Before you look at a semen specimen, what do you have to make sure of? It's liquefied, okay? And how long will that take?
An hour.
An hour. You're supposed to wait an hour. give me some possibilities if your semen specimen has a yellow color to it. Okay, you can have urine contamination, what else? Medications and prolonged abstinence.
Oh, yeah.
Cause it. Evaluation of sperm motility includes what? There's two things that I want you to know about when you're talking about how motile a sperm is.
Aggressiveness?
Okay?
Whether they're
Well,
like,
basically, you just said the two things. Speed and direction.
yeah.
Okay, speed and direction. Okay, I think I left this out on the lecture, so listen up. When you are observing sperm for morphology, remember when I told you you do a right stain on it? Okay, it's going to tell you in your book, you actually are supposed to observe a minimum of 200 sperm. Because I think if I don't go over that with you guys, you're going to tell me 100. Okay, it tells you in your book the minimum number that you're supposed to evaluate for sperm morphology is 200. That's in your reading. Okay, if you read your book, you'll get it. But make sure that you cover that area. Okay, there are counts on this test, guys, and it's going to be multiple choice, but you're going to have to be able to do the counts. The finding of 3 million neutrophils per milliliter of a semen specimen, what would that be indicative of? 3 million, what's a neutrophil?
A white blood cell.
Okay, so should you find 3 million?
No.
No.
Okay, so what would that be indicative of?
Infection.
Infection. Remember to study that matching section that I pointed out to you on the unknown chapter. There is a level 3 question that I already looked at it. It's not the exact question, but you need to make sure and be able to do the case studies on the semen chapter at the end of that. And then because, man, I've cut you guys so many breaks. I'm just telling you I do. I'm going to read you a question. This is on the test. It's worth 8 points because you have to study this, okay? And if you'll all come and if you study this, I'll give you the 8 points, okay? Because I think it's important. I think it's a big part of that chapter. Here's the question. Describe the 4 components of semen with regard to source, function, and percentage of fluid. I'm going to tell you right now, if I wouldn't have told you guys that, okay, I know that probably at least a quarter to half of this class would not have got full credit for that. But I know from previous classes, if I don't even mention that, I have a lot of people miss that question, okay? But you've got to study that to get that question right. There's quite a bit of detail that goes into that, and I think the longer I teach, I would rather you all get it right than not get it right, okay? So I'm just putting it out there. You do the work, that's worth 8 points. Right? And that's what I started off today's lecture with. Remember when I was talking about the bulbourethral gland, the prostate, the seminal vesicle, the actual testes, okay, the epididymis, okay? There's 4 major ones, but remember that chart I told you, that box, it actually tells you specifically what percentage of fluid each one of those contributes to.
Okay.
All right, also, there's a few questions in here determining, I'm not gonna go over them, you study it on your own, but it determines, like, it says if you have a high white blood cell count in spinal fluid, and you have a high percentage of lymphocytes, or what, you have to pick which type of meningitis it is, okay? There's an area in your book that goes over all of that, study it, okay, because there's a couple questions concerning that.
Yes, sir.
The grades on this test are usually a little bit lower on the other ones, okay? But I've already helped you out. I think 5 of you went left last week, and I have not added that to your test grades yet, okay? But I will at the end. So, having said that, let's take about a 5-minute break and we'll come back Who wants to do their PowerPoints today? I want some people going today. Okay. I want at least two,